rather eloquent pitch by my adversary, Dr. Ashit Mehta, in favor of peripheral nerve stimulator guidance for supraclavicular brachial plexus block. In the time allotted to me, I'll try and convince you why it is not such a good idea to use a peripheral nerve stimulator and why an ultrasound is the way to go. Yeah. As I said, I'll be speaking in favor of ultrasound guidance for supraclavicular brachial plexus blocks. And as I speak, I hope Ashit will be going red all over. Bala told you yesterday during the live block demonstration that when you use peripheral nerve stimulator for nerve blocks, you are guided essentially by surface anatomical landmarks. And in an effort to highlight these surface anatomical landmarks, you use a lot of marking in on the patient's skin, as is seen here. But we do know that neural elements that lie deep beneath the skin do not always follow the surface anatomical landmarks that are made on the skin. And this is because there are inherent variations in human anatomy. And it is these variations in anatomy that can flummox the most accomplished of regional anesthetists, whether they're doing the landmark-based technique or whether they're using peripheral nerve stimulator. And this is what leads to operator frustration, patient discomfort, multiple attempts, and failures. And this gives credence to this belief which says seeing is believing. As speaker upon speaker told you, today you will be able to see, if you use ultrasound, your nerve or plexus, the advancing needle as it traverses the patient's parts in search of the nerve or plexus, and the deposition of local anesthetic in the vicinity of the nerve or the plexus. So this is how you see supraclavicular brachial plexus. The pulsatile subclavian artery, superior lateral to the artery, is the brachial plexus staring out at you. This is the first rib, beneath which is the lung and the pleura. And though Ashit tried to tell you that this is a God's gift to mankind, this sort of a block, what I would like to let you know is that it is the introduction of ultrasound into clinical practice that has led to a rejuvenation in the performance of this block, also known as the spinal of the arm. See, this is not something I made. This is there on the NYSORA website. This is a rather busy looking algorithm. If you use a peripheral nerve stimulator for supraclavicular brachial plexus blocks, you will first need to identify the landmarks, and you will need to toggle between these twitches. You have no twitch, you have a shoulder muscle twitch, you have a biceps oblique triceps oblique pectoralis twitch, and you have a finger twitch. And for optimal success, you need to get a finger twitch. So if you do not get a finger twitch to begin with, you are actually moving the needle under the skin so that your endpoint of a finger twitch is achieved, and you really don't know what structures your needle is moving through in an effort to get that finger twitch. And this is how supraclavicular brachial plexus will look in an artist's impression, and that is where your inferior trunk normally lies. And this is just lateral to the subclavian artery and above the first rib, and the deposition of local anesthetics needs to be in this place, also known as the corner pocket. This is a block I did last year in... Can I have the audio on this? There's no audio on this. No audio. This is the needle coming in here, and that is the corner pocket, and as the drug is being deposited, you can see the divisions of the brachial plexus being pushed upwards. So this is something ultrasound will help you do. And we also talked of a dorsal scapular artery that sometimes lies in between the divisions of the brachial plexus, and in this case you can see the dorsal scapular artery, which is a branch of the subclavian artery, dividing the brachial plexus into an inferior component and a superior component. So if this is likely, you're not going to be able to block both of these with a peripheral nerve stimulator. If you have an ultrasound, you will be able to visualize both. And this is a block I did at the Aura last year. This is the pulsatile subclavian artery. That is what seems to be the normal plexus. But once I release the pressure of the probe, I will be able to see a dorsal scapular artery, which is actually coming in and transecting this plexus into a superior division and an inferior division. You see that is the dorsal scapular artery. And as you track the artery, it actually comes down and enters the subclavian artery there. So you have a superior division of the plexus there and an inferior division of the plexus there. And this is what ultrasound will help you pick up. Now, this is the first strip. This is the subclavian artery, and that is the plexus. In the same patient, on the other side, there was no first strip at all. That was the subclavian artery. This was the plexus there, and this is the sliding sign of the pleura. So if you don't have a rib to begin with, what are you going to work off? And this is what, again, ultrasound will help you pick up. This is the normal robust movement of the diaphragm on the side that did not receive a block. And on this side, following a block, the diaphragm is hardly moving. So you can also quantify an expected side effect, which is hemidiaphragmatic paresis, with the use of ultrasound. If you look at onion rings, the only pro in favor of onion rings is that it tastes good for about 10 minutes. Amongst the many cons, the significant con is regret at having eaten these onion rings. So if you use the same analogy for a peripheral nerve stimulator guided supraclavicular brachial plexus block, the only pro is that oftentimes your block works. But the failure rate will leave you regretting why you did not master ultrasound. And I conclude, people who indulge in fishing as a hobby, they also call it angling, often use this fish collar device, which is an ultrasonic device. When this device is placed in the water, it emits ultrasonic beeps that attracts fish in the vicinity towards this particular device. And as you can see here, it enhances the catch of the fishermen. So if fishermen can use ultrasound, we as medical professionals should definitely be able to use ultrasound for the ultimate benefit and the safety of our patients. Thank you.